Peter Wood. Commissioner Wood, you are first up to go.
Hi, good evening. I hope you're doing well. So I just want to start off, the last panel was excellent. I'm not surprised. I'm familiar with decrim poverty DC, so it was really good. I'm going to basically reiterate a lot of the points they made, but from a commissioner's perspective. So my name is Peter Wood. I reside in Adams Morgan in Ward 1, where I serve as advisory neighborhood commissioner. And today I'd like to testify regarding DC's approach to the ongoing opioid crisis. More specifically, I want to address areas where the Department of Behavioral Health is doing great work and how more compassionate legislation can support DBH even further. Let's briefly review some statistics. According to the Center for Drug and Disease Control, over 500 Washingtonians died of drug overdose in 2020, also in 2021, and likely in 2022. According to the Office of the Chief Medical Examiner in DC, 96% of overdoses in 2022 involved fentanyl. That's up over 20 points since 2017. And over that same period, about 84% of those who died because of opioid overdoses in DC were Black residents. These numbers do not and should not feel good to hear. Last year, I testified before the same committee addressing the same issues. That's not to say DC in general and the Department of Behavioral Health in specific aren't making strides to reduce these fatalities. Expanded access to naloxone and fentanyl testing strips are two examples of important changes in DC's response to the opioid crisis. I've even been told by a DC fire chief that their access to naloxone for potential overdoses is so good that they wish something similar for insulin was structured so that they could have comparable access. Now let's switch to policy for a second. I do not claim to have advanced expertise in drug policy or behavioral health, but I can attest that a significant portion of my academic endeavors during about a decade in research university settings dealt with the insufficiency of iron-fist policies toward narcotics consumption and distribution. Portugal's 2001 decriminalization of many drugs is a commonly cited example of how treating drug abuse as a public health issue and not a criminal justice matter can reduce stigma, reduce overdoses, and save public expenditures in the long run. In the 20 plus years since Portugal's experiment, other countries and municipalities like New York City that we've heard of have revealed comparable findings. We've made a lot of progress in terms of reducing stigma towards substance abuse in DC. But to borrow words used before me by Shane Sullivan with HIPS and Decrim Poverty DC, criminalization is stigma. Compassion must be at the core of how DC government functions. People don't typically use drugs laced with fentanyl because of malevolence or ill will. They do so in many cases out of desperation to reduce suffering. Too much of the United States, and frankly even Washington, DC, seems to believe that people who use drugs deserve to either go to prison or die. Rather than succumb to this toxic rhetoric, I want us to instead advance a moral, medically proven alternative to help prevent more overdoses. DC's Department of Behavioral Health needs to be equipped through decriminalization, training programs, funding community organizations, maintaining harm reduction centers, improving testing mechanisms, and further undoing the decades of harm we have seen come to a tragic climax in the current opioid epidemic. We're getting there, but the biggest changes needed are still ahead. All we need to get there is political courage. Thank you.